In this video, I'm going to teach you the head-to-toe approach. This is a wonderful approach again. I usually use this approach whenever the symptoms are very vague, and I use with pediatrics OSCE scenarios. For example, if a patient has come with fever, or if the symptom is tiredness, or if the symptom is anxious or nervous, or if the patient has confusion. See, all these symptoms are a bit vague. This can be because of any problem anywhere in the body. It could be from an ear infection, it could be a bladder infection, it could be anything. So that's when I use this head to toe approach, where I start with head first. I usually look at if there's any problems with brain. For example, let's take tiredness. So I usually see if there are any causes in the brain that can cause tiredness. Then I'll go further down to eyes. Then I will go to ear, nose and throat. Then I will go to the chest, where I will look if there are any causes in the chest like lungs or heart causing this. Then I will go further down to liver and spleen. Then I will go further down to bladder. I will think about kidneys as well there. Then I'll go further down to genitalia, then further down to legs and skin at the end. So this is a very important approach. Anytime you're dealing with conditions like confusion, let's take confusion. If you go head to toe approach, it could be dementia, delirium in the brain. Then you go further down, it could be severe ear, nose and throat infection, or it could be a severe lung infection. It could be some liver problems, it could be some renal problems, it could be a UTI that is presenting as confusion, it could be a severe skin infection, it could be cellulitis of the leg, it could be any of these things. See there, once you're brainstorming using the head to toe approach, you will not miss any diagnosis. I hope this approach has helped. Make sure you use it for pediatrics and when you have vague symptoms.